also will be having. Okay. Now there are three spinal reflexes. Okay. One is flexor withdrawal, one is extensor thrust, and one is cross extension. Okay. In flexor withdrawal, okay, the position of the body's position is supine, head in midline with both the lower limbs extended. Okay. Stimulate sole of one foot. There will be sudden jerky flexion of the stimulated leg. It presents from birth and it disappears by 2 months. Understood? Flexor withdrawal. Okay. Body's position. Okay. Supine with both the lower limbs extended. Understood? You stimulate sole of one foot. Just stimulate. There will be sudden jerky flexion of the stimulated leg. Understood what I am talking? I am stimulating the left side of the sole of the feet. There will be sudden jerky flexion of the left side of the lower limb. Understood what I am talking? Sudden jerky flexion. You just stimulate. Just there will be sudden jerky flexion. It should appear from birth and it should disappear by 2 months. It is called flexor withdrawal. There is something called extensor thrust. Body's position should be supine, head is in midline. One lower limb in flexion, the other lower limb in extension. So please remember, in extensor thrust, the baby will be in supine line. One lower limb will be flexed, the other lower limb will be extended. Okay. What is the stimulus? You stimulate sole of the flexed foot. Response, uncontrolled extension of the stimulated leg, which should present from birth to 2 months. So please do understand, extensor thrust. The baby will be in supine line. One lower limb will be flexed, other limb will be extended. What is the stimulus? You give stimulus on the sole of the flexed foot. Understood what I am talking? The response will be sudden uncontrolled extension of the stimulated leg. You are getting what I am talking?
Yes.
Okay, this is called extensor thrust. There is something called, it should appear from birth and it should disappear by 2 months, which is normal. If it is present after 2 months, then it is abnormal. Understood? Any reflex which will present beyond the age of disappear, then we call it as abnormal. Okay. There is something called crossed extension. What is crossed extension? The body's position will be the same, supine, head in midline, one lower limb in extension and one lower limb in flexion. But what is the stimulus difference? You have to stimulate sole of the extended foot. The response will be, already this is flexed, there will be slow flexion of unstimulated leg followed by adduction and finally extension. And please do remember, it is very important, which is called crossed extension. In crossed extension, the baby will be in supine, head in midline, one lower limb will be extended, other limb will be flexed. Okay. Now you stimulate sole of the extended foot. Okay. Now response will be on the unstimulated leg. There will be slow flexion, adduction and extension of the unstimulated leg. You are getting what I am talking? I am stimulating here, you are getting response here. That's why we call it as crossed extension. What is the response? Slow flexion, adduction followed by extension of the unstimulated leg. It should appear from birth and disappear by 2 months, which is normal. Is it clear what I am saying? These are called spinal reflexes. Okay, there are 3 spinal reflexes. One is flexor withdrawal, extensor thrust and crossed extension. pictures. Okay, the picture is very simple. If you can understand, let's have withdrawal. We are giving stimulus. Okay, there is sudden inflection of the stimulated leg. Extensor thrust. One leg is in flexion, one leg is in extension.